Hello everyone, this is the continuation of lectures on health. So now we'll be learning spectrum of health, determinants of health and indicators of health. Spectrum of health. Spectrum word means range. So health is not static, it is dynamic process. So person may have a good health today, may not be having a good health tomorrow. So in the spectrum, the highest is positive health, the lowest is death. So person may have positive health and better health and then freedom from sickness, unrecognized sickness, mild sickness, severe sickness, and then death. Then the next one is about determinants of health. There are a lot of determinants. So one is biological determinants, includes genetics and immunity of that person, age, sex, race, and physiological status. That means pregnancy, lactating, puberty. That status also affect health. And next one, environmental. There are two environment, microenvironment. Microenvironment, immediate personal surroundings. So family will come, workplace, neighborhood will come under this. And macro environment can be divided again into physical, biological, social. Physical, water, air and climate. In biological, plant, animal, microbes, vectors. And then social environment, how public health service, economic systems and all. So under socio-economic determinants, we have economic status, education, occupation that can influence the health. Socio-cultural, religious practices, gender roles, cultural beliefs, family structures and traditions that can also affect health. Next dimension is behavioral dimension. So poor nutrition and inadequate sleep, insufficient physical activity, personal hygiene, risky behaviors like addiction, alcohol, smoking, and all can affect health. Next one, health services. So, inadequate health services can lead to health problem and aging of the populations. Elders may get more diseases. And gender, women are more affected by violences and reproductive health problems and nutritional issues. Then health rights is also there. Trust, dignity and transparency also matters for good health. And equity and social justice. So poor and rich people should be treated equally. Otherwise that may affect health. Information and communication. When we give more knowledge, that way change the attitude of the person, eventually behavior of the person will change, that will improve the health. And science and technology. Advanced technologies, diagnostic techniques and medications will contribute to a better change toward the health. And the last part is indicators of health. Indicators used to measure something. So here health is not measured by a single indicator. It has multiple dimensions. Multiple factors are affecting the health. So we should measure the health with multiple indicators. So first one is morbidity indicators. We can divide morbidity indicators according to frequency, duration, severity. Frequency, we have incidence, prevalence and notification rate. Duration, some of the example, duration of illness, duration of hospital stay and sickness spells can be calculated. And for the severity, we have disability rate, readmission rate, case fatality rate. And mortality indicators, we have crude death rate, specific death rate, proportional mortality rate and survival rate, case fatality rate. We'll study this in detail in next following lectures. Next one, life expectancy at birth and life expectancy at 1 year. So, very important indicator for socioeconomic development. So, perinatal mortality rate. Perinatal period is more than 28 week of gestational age to 7 days post after delivery. So if any death of children within this period, that is called as perinatal mortality rate. The denominator will be live birth into multiplier is 1000. Now comes neonatal mortality rate. Neonates are birth up to children of 28 days are called as neonate. So early neonates birth to 1 week of life is early neonate. Late neonate 1 week to 28 days. Post neonatal period, that post neonate is 28 days to 1 year. Now comes neonatal mortality rate. So we learned that neonate is of birth to 28 days. So will death during this period divided by same live birth multiplier is 1000. And comes infant mortality rate. Infants from the age birth to 1 year are called as infant. So death of children among this age divided by live birth into 1000. Next one, under 5 mortality rate. Under 5 children mean birth to up to 5 years. So death during this year divided by live birth into 1000. And comes child death rate. So far we have studied like MR, mortality rate. Now comes little different death rate. So death rate formula is little different. Children here is not 0 to 5 year. Here children from age group is 1 to 4 year. So death among 1 to 4 years divided by children's of 1 to 4 year into n1000. Now stillbirth rate. Stillbirth, when we call stillbirth is after 28 week of gestation, we to till birth age, the term, how many if death happened to children, we call as stillbirth. Before less than 20 week, we call as abortion. So after 28 week, we call as stillbirth. So death during this period divided by stillbirth and total number of stillbirth and live birth is called as stillbirth rate. Now MMR, that is maternal mortality rate. So death between maternity means pregnancy to 42 days. This is puerperal period. So this much days, during this days if any death happens of mother, so that is called as maternal mortality rate. And maternal mortality rate denominator and ratio denominator changes. In ratio, denominator is not a part of numerator, so we put live birth here. In rate, numerator is a part of denominator. So death of women among those age group of women. In ratio, death of women among live birth. That multiplier here changes. So far we have studied 1000, now 1 lakh. For maternal related thing, multiplier is 1 lakh. Now next indicator is disability indicator. Quality adjusted life years. Quality adjusted life year, and DALY is disability adjusted life years. So here, what is QALY? Number of years gained after treatment of intervention. DALY, number of years lost due to disease, disability or premature death. Here lost, see here gained and here lost. And next indicator is environmental indicators. Water pollution, air pollution, access to safe water is there or not, and sanitation facilities adequate or not, and solid waste and noise pollution how much, radiation is how much. These are environment related indicators. Nutritional indicators like anthropometric measures, what is the weight, what is the expected weight, and height, mid upper arm circumference. So many things are there in anthropometric measurements. And then socio-economic indicators, per capita GNP, rate of population increase, dependency ratio, literacy ratio, housing and family size, level of employment, per capita, calorie availability. These are all under socio-economic indicators. Some of the socio-economic indicators: educational surveys, distribution of income, social security schemes, how much they have, socio stratification and mobility. And comes healthcare delivery indicators: doctors population ratio, doctors nurse ratio, population bed ratio, nurse bed ratio, and population per health center, population per trained birth attendant. And comes utilization indicators: proportion of infant fully immunized, proportion population using family planning services, percentage of ANC antenatal women receive ANC care. Health policy indicator: proportion of GNP spent on health service, proportion of GNP spent on primary health care, proportion of GNP spent on other health related activities like water, sanitation, housing, community development. Now, social and mental health indicators: suicide rate, homicide rate, act of violence and other crime rates, how much RTA, and juvenile delinquency, alcohol, smoking, drug abuse, battered baby syndrome, family violence, etc. And quality of life indicators like human developmental index. The next one is physical quality of life index. So we'll learn about this in detail. Other indicators: basic need indicators. It's a summary of above main indicators: death due to disease, life expectancy, access to water, calorie consumption, literacy rate, GNP per capita, room per person, doctors and nurses per population. So we are at end of our lecture. We have learned about spectrum of health and from positive health to death. Then we learned about determinants, that what are the factors affect the health. And last one is indicators of health. So how to measure health. Hope you understood the lecture and thank you for listening.